The need for palliative care in Uganda has exponentially increased due to the aging population, the increased number of non-communicable diseases, and the higher prevalence of HIV/AIDS. The World Health Organization estimates that 1% of the population, or about 400,000 people, need palliative care. Most palliative care services cater mainly for AIDS and cancer patients, with a few now taking on other illnesses that cause serious health-related suffering. Palliative care services in Uganda include pain and symptom control, social and psychological support, cancer screening, provision of antiretroviral therapy, HIV testing and bereavement support, among others.
I agree that this palliative care approach that we're talking about is not a discipline that has been here for a long period of time. Actually, we are coming only to 30 years, and therefore not many people understand or appreciate what we are talking about.
However, according to Mwesigwa, it has been found that the provision of palliative and hospice care in most cases imposes socio-economic challenges on patients and their families.
For example, we see a lot of neglect, we see sometimes issues with succession planning, we see issues with property grabbing, and sometimes we see gender-based violence because somebody is unable to do every day. But we also see that some people who have been sick for some time leave work, so they have to be at home, they are not working, and so livelihood is impacted.
Due to a constraint in resources, the Palliative Care Association wants government to increase its support towards this sector.
The other thing that we are doing is to make sure that we don't work alone, that the health workers don't work alone. As a civil society organization, the Palliative Care Association of Uganda, we have mobilized all people who are into healthcare. We have advocated at the Ministry of Health level. The ministry has offered a directive that every hospital should set up a palliative care unit. And so we are amplifying and speaking to everybody.
Meanwhile, other sector players like Joint Clinical Research Center argue that it's also time to think of alternative treatment procedures for diseases like HIV/AIDS in order to support patients.
This is what we are using now, drug treatment. Someone swallows drugs, and then gets better. But what we want to do now is the future treatment, which is gene therapy. For sickle cell disease around the world, the same principle has been used to cure about almost 200 people. But much of that technology is in the West, which is not fair because HIV and sickle cell disease, the largest burden is in sub-Saharan Africa.
On behalf of the Ministry of Health, Dr. Charles Olara, the Director of Curative Services, has noted that efforts to raise resources towards the provision of palliative care in Uganda are already underway.
Well, we've not been able to get all the resources which we need. But as you know that just like all other diseases, if we can be able to do prevention for some of the conditions which will need palliative care, then we can be able to reduce the need of one. But we'll continue to advocate. That's why we have organized a march with the parliamentarians. Is one of it that, apart from just increasing awareness, but also we're using it as a mechanism so that since they are the people who appropriate resources, they should be able to provide resources for palliative care just like they provide resources for the other services across the country.
But in the meantime, the provision of these services at all regional hospitals and health center force is one of the measures that has been undertaken to ensure that people who need these services can access them. Joyce Nakato, NTV Weekend Edition.